because we've been working very closely with the West African community, we have also heard concerns and situations that have been happening that aren't pleasing and that don't make us happy, such as some of the ones that you just described. But also we've heard students being bullied in school, West African students. We've also heard of taxi drivers who folks won't get into their taxis, and that has all kinds of implications, economic implications, not only for that driver and his family here in this country, but potentially back home if he or she are sending money back home. And so a large part of our conversation is about stigma, because stigma then leads potentially to discrimination. And again, we don't want a situation in which people are fearful of going to seek care because they are being stigmatized and potentially discriminated against. So we have to ensure that, again, communication and education and information that we know is factual. We can only work with the science that we have, what we know about Ebola and what we know about the transmission of it, and really stick to that. There are many questions that are revolving around this. There are many myths, there are many fears. However, we have to stick to what it is that we do know at this time. And so our message, that we try to get out is, again, that for our communities, our West African communities, ensuring that they know that they cannot be targeted because of their immigration status. They will not be asked that when they go to the emergency rooms, nor their ability to pay. That this is really, Ebola is a human tragedy, and it doesn't have biases. And I think it's very important for people to know that, our responsibility in New York City is to make sure that all New Yorkers feel protected and feel safe. And that means that our messaging cannot just be to West African communities, but for all New Yorkers, as a whole. And so in addition to doing outreach with West African communities, we are also now working on more public service campaigns or public service announcements that will be launched very shortly to ensure that more New Yorkers are getting the information that they need. We've been working out of the Center for Health Equity with other groups across the city, nursing associations, other physician associations, elected officials, to make sure that they're getting the information that they need to know about Ebola and the way it's transmitted, the way it's not transmitted, and what is it that they can do. And a big part of what it is that we all can do is getting the information on the website. If you haven't heard it on the news yet, because a lot of the symptoms, the basics about Ebola, it really has been on the news. What happens is that we have an overwhelming I guess, conglomerate of other information that's out there that becomes very confusing for folks. And the way that social media, as powerful and important as it is, it's also, it can be very misleading for folks, and so I think the more, we're able to get out in front and we're able to communicate in our various platforms that we have, and to get the information out there, the more that we are able to also work with some other key leaders in the city to also be messengers of this particular message, the better that we can reach the enormity rather of in New York City, because it's 8 million people that live here, which is a lot of people to get the information to. We have definitely, this has been on our radar since back in March. And really in July, well before Duncan even came to the country, we have been preparing and thinking through what does it mean to prepare, who do we need to have conversations with, what is it that we need to do. So we as a health department had started already having those conversations. But I think there is, a general awareness in the sense of, and there's a human nature aspect to that, of when something ends up in somebody's backyard, they tend to pay attention to it a little bit more. Is it fair? Is it just? I think, we would all, or many of us would be in agreement that no, we're a global, society, we're a global community, so that we should have some level of interest in what's happening in other parts of the country and be responsive to it. But there are many reasons, political, financial, economic, reasons of why possibly a response didn't happen in the way that people felt it should. But I can say, at least for the New York City Department of Health, we have definitely, this has been on our radar, and we have been active and pretty mobilized for a couple of months now. We are working with hospitals across the city to ensure that they are able to identify, isolate, quarantine, or treat, depending on where the hospital is. We have an entire website with lots of information that we're updating on a daily basis, even multiple times during the day, that has information in regards to what can daycares do, what should universities and colleges do, what are just the basics about Ebola. We have an Ebola 101 card palm card that we're passing out in many different places. And on that card, you know, it talks about how you cannot, or how you would, or how Ebola is transmitted, but it also clearly states that nobody should be asked about their immigration status, and nobody should be denied care based on their ability to pay. So that we really want to encourage folks that if they are traveling back and forth, and for whatever reason they may be at risk and they may be, you know, feeling symptoms, that they do go to the emergency room, or they do call up their physician, or they do call 911. They do whatever they have to do in order to seek care and not stay in their homes. And we want to make sure that we're prepared. We want to make sure people are informed, and we want to make sure that we help quell the fear and the hysteria that we know that is out there, that are on many of our minds. And the best way that we can do that is really, one, doing our role in making sure hospitals are prepared and other health facilities are prepared, but also making sure that people are educated. And I think that's all of our responsibility as well, is that when we get the level of education, we hear the information, we hear it from a trusted resource, that we also share that information. Because, you know, we really feel that it's the miscommunication, the misinformation, and fear that will really perpetuate this disease in a way that it doesn't have to. This is when protocols, policy, and training become extremely important. And I think the story of, and the situation of what happened with Eric Duncan, or Mr. Duncan, when he went to the hospital, is a demonstration of where there was a break in a protocol, or a protocol wasn't in place, particularly at that time. And, you know, part of our training with the New York City hospitals and emergency rooms and departments is, you know, what are those questions that need to be asked, and to ensure that those questions are asked so that we do know about where has a person been and with whom have they been with. Anytime a person comes into the ER presenting with fevers and flu-like symptoms, and anybody really should be asked overall. And so again, even if there's a policy in place, we have to make sure that people know about the policies and the protocols, and that people are trained on it. And so that's why we've been working very diligently with the hospitals across the city to help ensure this. And we know that you cannot get Ebola from, you know, the air, or it's not airborne. You have to be in direct contact with somebody's fluids that has and is sick with Ebola. And just to mention a little bit about, you know, the disease and how it presents itself, it can present itself with fever and flu-like symptoms initially. But what becomes very risky, and why healthcare workers are at greater risk, is because as somebody becomes sicker with Ebola, they actually become more infectious over time. And so when they are getting to the point where they have to be in the hospital, they're losing like 10 to 15 liters of fluid a day potentially. Whether it's from bleeding or vomiting or whatever it is, they're losing a lot of fluid, and that puts whomever's at risk with them, or whomever's interacting with them, at greater risk. And so I like to put things in perspective, in the sense of, if we look at Mr. Duncan, he was around his family, a large part of his family, when he first came to the country, and they have already passed their 21-day incubation period, and none of them acquired Ebola. But it really was the nurses who were caring for him at a very critical time in which he was very infectious, and that there possibly was a breakdown as far as, you know, the protection gear that was put on. But we have to look at the other 4 to 5 cases that came to the United States that have been treated here in Nebraska as well as Emory, and none of the healthcare workers acquired Ebola by taking care of them. And so I think it's just really putting in perspective, and for the most part, you're not going to see somebody walking in the street that's that symptomatic. They're going to be really ill, and they're going to be in the hospital. And a person doesn't become contagious until they start showing symptoms. So I just like to put that out there as far as a perspective of our risk, and everybody's risk of actually acquiring Ebola is really pretty small. And that overall, the most important aspects of this is that, one, getting the information out, sharing the accurate and correct information, going by what it is that we know and the science that we know. There is no cure at this time. There is no vaccine. Yes, there have been some treatments that are being tested and being worked on, but currently we have no cure and no vaccine. So if you want to get more information, you can go to the nyc.gov /health website, and there's plenty of information there. You can also call 311. We have lots of frequently asked questions. We have information on how to, you know, deal with mental health status. And that's the other piece, is the mental health piece. Again, this is a human tragedy. We have families that are dealing with 15 members in their family dying within a month. And so now on top of that, to be in this country, not only they're dealing with their grief and their sadness and loss from back home, but now they're dealing with like the stigma and the discrimination potentially here. So there are some communities that are in, you know, severe pain, and I think there's a level of consciousness and just humanness that we have to remember through all of this.